Some women may require a cesarean delivery. Few weeks back, we discussed the indications of a cesarean section. Some women may require a planned cesarean section, while some may require an emergency cesarean section during the trial for a normal vaginal delivery. Now, whatever it is good to be prepared to know what the sequence of events will be on the D-Day. So last week we took you through the journey of a normal vaginal delivery, and today let's see what happens during a cesarean section. In a planned cesarean section, 2 or 3 days before, you will be asked to take pre-operative investigations like complete blood count, coagulation profile, and other investigations based on your medical history. You will be asked to meet an anesthesia doctor for a pre-anesthesia checkup to check if you are fit for anesthesia and what kind of anesthesia is suitable for you. On the day of the surgery, you will be asked to remain empty stomach at least 8 hours before the scheduled time of cesarean section, which means you should not be taking anything by mouth, not even water. Have a good shower in the morning. Do not apply any creams or lotion on the abdominal skin. Remove all jewelry and any nail paints. Do not shave your abdomen in the morning. You will be asked to report to the hospital generally 3 to 4 hours before the scheduled surgery time. On arrival to the hospital, you will be taken to the room, asked to change into the hospital scrubs. The nurse will then check your vitals, check the baby's heartbeat. An IV line will be put and you might be given an antacid injection. In case you require an emergency cesarean section during labor, the doctor is going to explain you the reasons and the pros and cons of the surgical delivery. You will be asked to sign an informed consent document which explains about the procedure, the alternatives, the risks, the complications, etc. Remember, you have a right to ask any questions from your attending medical staff anytime. You will be now taken to the operating room roughly about half an hour before the scheduled time of surgery. The nurse will put the ECG leads on the chest and a pulse oximeter probe on your fingers to monitor you. You might be put DVT stockings or a DVT pump on your legs to avoid the risk of clot formation. Most of the cesarean sections are done under a spinal anesthesia. However, some emergency situations might require a general anesthesia. You might be given the spinal anesthesia in a sitting or a sideways lying down position. You will now be made to lie on the table flat after the spinal anesthesia is done. You will now start to feel warm in your legs and feel some tingling sensations in the legs, and soon they will feel very heavy. You will soon be numb below your chest level. Usually, a screen is put separating you from the operative field to maintain the sterility of the operating area and also so that you can't see what's going on there. An intravenous antibiotic is usually given at this time to avoid any infection. A catheter will be put in your urinary opening to drain the urine, and now the tummy will be cleaned with an antiseptic. Most of the cesarean sections are done using a transverse incision just above the bikini line. After entering the abdomen, the incision is made on the uterus and the baby is delivered. You may feel the pressure, pull or push during the procedure, but you will not feel any pain. Do not worry. We usually follow the delayed cord clamping. Soon the placenta is delivered and now the uterus is sutured, followed by the abdominal wall. If the pediatrician feels the baby is stable, you might be given the baby for a skin-to-skin contact or even a breastfeeding. You might even ask for a photograph with your baby at this time. The cesarean section procedure typically takes about 30 to 45 minutes. After the procedure, you will be shifted to the post-operative area for an observation, and usually after 2 to 3 hours, you will be shifted to your room. You will not be allowed to take anything by mouth for about 6 to 12 hours. First, the liquids are started, followed by a soft diet when your bowels are moving properly. Urinary catheter is usually removed by about 12 to 24 hours post-surgery. You will now be encouraged to move after 12 hours. Typically, the next day you will be able to walk with some support, and you will be given adequate painkillers to take care of the pain all this while. Most of the women would require 3 days post-operative stay in the hospital. Once you are home, the complete recovery usually takes about 4 to 6 weeks. So I hope today you liked this 5 minutes quick run through the cesarean section. So we are wrapping up our pregnancy series for this season, but please do not worry, we'll keep revisiting the pregnancy topics frequently. Until then, we have a lot of exciting things coming on Maitri. So stay tuned in, and like always, today if you like this show, please do not forget to like, share and subscribe to Maitri, and I will see you soon.